More Americans are now living below the poverty line.
Now we're seeing people losing their jobs, their homes.
50 years old and unemployed, she does not have access to health insurance.
It's really by the grace of God that we get by each month.
She spends half her monthly fixed income just on prescription drugs.
They're working and they don't have health insurance, and they can't afford to buy health insurance.
We knew what we wanted to do. We knew that we wanted to help those who were falling through the cracks and who were showing up at ERs very, very ill.
So we thought, gosh, is there enough community interest in this project? And out of that developed the clinic concept.
Like many success stories in the world, the clinic began as an idea, a simple idea to solve a complex community problem in McLean County. When the discussions began almost 22 years ago to address local emergency rooms being filled with patients who lacked insurance, no one could have imagined how clinic services would evolve into what they are today. This grassroots, local solution to a local problem created our mission that still guides us today. That mission is providing high-quality medical care to the underserved of McLean County through the operation of a free medical clinic.
There was this gap of people who were underinsured or were between insurances, and how could we address the needs of those populations. My background had been in the emergency department for many years at St. Joseph, so I had seen a lot of those patients coming through for treatment because they had nowhere else to get it.
I had been to a healthcare clinic that the Presbyterian Church was involved with on the border between Juarez, Mexico and El Paso, Texas, and I had been very interested in their free clinic and some of the work that they were doing, and I was getting more and more a sense that even though Bloomington Normal and McLean County has had a rich heritage and have great social services, I was concerned about people who were falling through the cracks.
The McLean County Medical Society 22, 23 years ago looked at what was going on in our community and the access to care for population within the community who didn't have third-party payment mechanisms or third-party payment capability.
The working poor, the people who are doing everything they can, working 3 different jobs, and at minimum wage, whatever minimum wage is this week, it's not necessarily enough to feed a family of 4 real well and to pay for health insurance. The working poor need some place to go.
It was really the patients with the chronic diseases, the diabetes, the heart failure, that there was just really no net to capture those patients in and get them into a good treatment program. They had no money to get their medications.
We thought about how we could do this. There were some models out within the community, or within the state, and Bob Reardon, who was then the president of the Illinois State Medical Society, challenged the executive committee of McLean County Medical Society to come up with some sort of plan.
I can remember an early meeting with John Kruger and Paul Peterson and Sue Clark saying, yeah, we need to get this going for adults now. Made a lot of sense. The prenatal clinic was originally a partnership between OSF and Bromen, and logical that they would step in and be partners along with the adult clinic.
The medical society sort of came up with the concept, and they were looking for people, and there was a community meeting, and Paul Peterson ran that, and then he just asked for volunteers, and I don't know whether he told me I was going to volunteer or he was kind of suggesting that I should. And then there was another guy there who, so I was waiting to raise my hand, and then another guy quickly threw his arm up. His name was Al Shepston, and I had known Al because he'd been a television personality. He'd been on one of the Peoria stations, I think, as a sportscaster. And so we started off on the steering committee. Where do we go from here?
I just remember hearing about it. I was active in the Nurses Association at the district and the state level at that time, and just felt like it was something that nursing needed to be involved in. And then when I came to the meetings and looked at the data, it just became very apparent that that we needed to get this done, and I really wanted to work with the clinic.
We had a meeting a community meeting down at the Bloomington Public Library, and there was a bunch of people who came. There was a lot of giving people in that meeting, a lot of folks interested in how we survive and work as a community, and out of that came a whole bunch of work. The initial steering committee developing bylaws and developing process, developing people. Then that developed into a board, and that board then progressed in how we would go about marketing the community clinic, how we would go about getting patients, who we would serve, and it's progressed from there. If Bloomington Normal can't take care of its own, what community can?